Okay, let's talk about these two nebs. The Acorn neb, which is kind of our, a lot of people use and have used for years, and the Salter neb, which we also use, that has one-way valves and one-way valve mechanisms built into it. What I want to talk about is why you can't interchange the mask, and specifically why you can't use the Salter neb mask with the one-way valves on the Acorn neb, and why. So let's look at this Acorn neb real quick. So our Acorn neb, or AirLife neb, is flow-driven neb, usually runs between 8 to 10 liters per minute to aerosolize liquid into a gas to breathe in. It goes into this mask, and it's coming into this mask at 8 to 10 liters per minute. Now, when you have this on a patient, if their inspiratory flow, for instance, should be 20 liters a minute, they're going to breathe in the 10 liters that's coming from the mask, and then 10 more liters are going to be pulled in from the room through these holes, to meet their inspiratory flow demand. If these holes weren't there and they were closed, and this was a tight fit on the mask, as they breathed in, they would suck the mask in. They wouldn't be able to get enough flow to meet their inspiratory flow, and that would cause distress. Now, when you look at the Salter neb, what happens is you still drive the neb with your flow, but you have a one-way valve right here, and you have one-way valves on the mask itself. So the same patient that's being given the Salter neb, if you're running it at, let's say, just say 10 liters a minute on the Salter neb, if their inspiratory flow is 20 liters per minute, on the Salter neb, they would suck in and they would close these valves down, stopping the air from coming in from the room, and then pulling this valve open, which pulls air in from the room through the neb and then into the mask itself. So they're able to meet their inspiratory flow demand of 20 liters per minute, 10 liters from the neb and 10 liters pulled into the room through this valve right here, and not through the mask itself. Now, if you take this valved mask that's supposed to be used with the Salter neb, and you place it on the Acorn neb to give a neb treatment, now you're going to be given 10 liters of flow, or 8 to 10 liters of flow through the Acorn to give them their neb. You'll have the mask on their face, and if their inspiratory flow demand is 20 liters per minute, they're going to need 10 more liters per minute when they breathe in. Well, on this mask, these valves are going to close on the mask, and there is no one-way valve on the Acorn neb to allow flow from the room to come into the patient. So that patient is not going to be able to meet its inspiratory demand and should collapse the mask if it's a tight fit. Minimally, they're going to be in distress, right? So they're going to be like, I can't breathe. I'm trying to breathe in, and I'm not getting the flow that I need to breathe in, and I'm having resistance, and that's going to cause agitation. And that's fine. And in adult patients, you would recognize that, and the adult would be like, I can't breathe, and you would get to the point that this mask is not the right mask. The problem we have with pediatrics is not all, but most pediatric patients that you're trying to give a neb to are not wanting the mask on their face. So they're at baseline fighting you over the treatment. So it increases the risk of this complication happening. So what we want to make sure, and this video is to illustrate, is why we can't interchange this one-way valve mask onto the Acorn neb, and why it should only be used with the Salter nebs with the one-way valve that's built into the nebulizer itself, as well as the valves that close the mask down.